to be recording this session. If we could go to the next slide. All right, and we are just asking if you could go ahead and update your Zoom name to include your name and the name of your organization. And for our icebreaker, we're going to ask if you feel comfortable doing so to unmute and share your favorite winter activity. I can go ahead and kick us off, and I'm just going to have to say bundling up. I love to layer, and more is more for me. So I'm going to have to say layering up and wearing like 15 layers, because I'm also somebody who is like constantly cold. So I will popcorn it to Gretchen.
I'm Gretchen Schroeder. I'm from Transform Health. We are partnering with HealthBegins on this great project. And I love to ski and snowshoe, so I'm super excited that the mountains now have snow, and I'm trying to find time to get up there. I'll popcorn it over to Amber.
I think I'm going to have to go with various hot tub experiences in the winter.
Ooh.
So whether I don't have my own. So whether it's crashing someone else's or like I'm a hot springs person, I think that's my favorite winter activity. And I will send it to Debbie.
Thank you. My favorite winter is cuddling. And Paula.
I like it.
Good morning, everyone. Again, my name is Paula de la Cruz. I'm a project coordinator, and my favorite winter activity, it is actually skiing and snowboarding.
Ooh.
Yeah.
Like mine. I'm liking this. Next.
I guess that's me. I'm not, a snowbird by any means. So I guess my favorite winter activity is eating and drinking and baking.
Ooh, baking, yeah. We'll popcorn over to Karen.
Hi, Karen Bergman with TLC Child and Family Services, and I like the snow.
Perfect. Thank you for sharing, everybody. I think everybody went. So thank you so much for participating. And please feel free to use the chat as needed for any questions. And before we move forward, I did want to give our MCP partners on the call a chance to introduce themselves. They've already participated in the icebreaker, but Paula and Debbie, if you wanted to go ahead and introduce yourselves to the group.
Hi, I'm Debbie McAllister. I am the director of strategies here at Partnership Health Plan.
And again, my name is Paula de la Cruz, and I work along with Debbie on all things community supports. I'm a project coordinator. Thank you.
All right, awesome. Thank you so much. And we'll go ahead and move forward. Next slide, please. All right, and then we'll get into the session agenda. So the objectives for today is to cover becoming a community supports provider. We're going to go into some community supports billing. We're going to do Q&A for part 1, community supports case study, CalAIM funding opportunities, and then we're also going to do another QA. And we always do encourage folks, if you have questions, please you don't have to at all wait until the Q&A section. We do want you just to let us know if you have any questions. You don't have to wait till the Q&A section. All right, next slide, please. All right, in today's objectives, we're doing a 3-part training series. This is the second of that. Our third one will be next Tuesday, the 13th. And we designed this approach with input from partnership, and we'll continue to tailor it based on your feedback. We really want people to get to know each other better. We want you to get a better understanding of the expectations as far as becoming a community supports provider and the process for becoming a community supports provider, and also the CalAIM funding opportunities as well. And then context for today's sessions. Last week we had session 1, that was pathways to becoming a community supports provider. today's session is becoming a community supports provider. And then next week, which again is the 13th, is best practices for becoming a community supports provider. All right, and now we'll get into the program overview. So we have our partners, and I'm going to do this really briefly. We will be sending out the slide deck so you can really look more in depth into this, but CalAIM Links is a collaboration between Transform Health, who Gretchen and myself work for, Aurrera Health, and HealthBegins, and it's funded by California Healthcare Foundation. They're generously funding us to do this work, and to learn more about any of our partners, please feel free to use the links that are going to be included in the presentation. And this is our wonderful senior program officer, Carlina Hansen, who's been very supportive throughout the process in helping this project come to fruition. Next slide, please. And just some background. And basically in 2021, when we knew CalAIM was going to be a vision that becomes fully realized, a project proposal was submitted to CHCF. From their stakeholder listening sessions and learning sessions were convened to ensure support needs and concerns were being heard in order to inform curriculum design for our TA sessions. Next slide, please. And then just at a really, really high level, we've hosted 9 TA sessions. We've done them. There were statewide, and then we also did county sessions. And we have plan partners. We partnered with HealthNet Partnership and Health Plan of San Joaquin, and a total of 769 individuals and 710 distinct organizations participated in at least one of these sessions, 130 represented organizations in priority counties. And our program goals. So there are 2 tracks, as I mentioned before. There's county and statewide, and we've been basically seeking to advance equity, recruiting CBOs that are led by and serve people from communities that are historically marginalized by societal policies, and focusing on identity needs, identifying needs, building knowledge, and elevating barriers to providing community supports, building relationships that matter, seeking to build impactful relationships by facilitating local learning, networking, and community building among CBOs and Medi-Cal, managed care plans, and basically seeking to strengthen statewide capacity among community-based organizations for CalAIM Community Support Services. And then the county sessions, as I mentioned, there was the statewide track and then the county track, which is what you're in today for Napa Sonoma. And this is our third and final, or our second of 3 TA sessions. And we also held them in Stanislaus, San Joaquin, and then there's also Fresno, Kings, and Tulare. Over the past few months, we've had that. And as I mentioned several times, we will have our third and final TA session. It will be December 13th from 11 to 12:30. And you can also, when the materials are sent out, you can use, you can reference all the websites that are linked on there. And we can also drop the link for the microsite for the CalAIM Links program as well. And these are just some assumptions we are making about who is present today. We're assuming you're in Napa Sonoma County, you're interested in community supports, you have a basic level of understanding of community supports, and if you don't, that's totally okay. We're here to help. And then also we have prerequisite. We have a CBO readiness assessment for our project team to assess your organization's level of readiness, and we will be dropping that in the chat so that you can take that assessment. All right, and now we're gonna go ahead and do a poll. Just give me 1 second. All right, and the first poll here is, what has surprised you about the contracting process so far? And this is an open-ended question. We just kind of want to gather your thoughts about just the process so far, what you know, reflecting on it, what you feel just really surprised you the most. I'll give about 30 more seconds since it's so folks can type an answer in. All right, we have a few responses, so I'm going to go ahead and in the poll and we can share. And if you think of something along the way, please feel free to pop it in the chat too. Okay. I'm trying to see the details. And it says people I would expect to be in the know, not having answers to questions I asked. That's really great feedback. And I am not involved in the contract process. Okay, that's great to know. Perfect. Thank you so much for your participation. All right, and then we just have one more for this portion. Okay, what is a term you keep hearing and you still don't know what it means, but you are afraid to ask? Or any burning questions you might have? About 15 more seconds. I'm gonna go ahead and end the poll. Okay, and some feedback, not a term, but a concept. Will the ECM rate actually cover expenses? That is a phenomenal question.
All right. Well, hopefully we can talk about all those things more throughout the presentation. Thank you, Carrie. That was awesome. So let's jump into the meat of our presentation here, which is around community supports overview. We'll go over the contracting elements a little bit more. We did hear you last week and what you wanted to talk about more, so we have a lot more information about billing, claims, all that good stuff. So we will dive into that, and then we'll wrap it up with some CalAIM funding discussions as well. So here's kind of a nice visual of what the community supports providers' expectations are per the state standard terms and conditions. And partnership does follow all of the state standard terms and conditions. So we talked about service delivery expectations last week, quality and oversight expectations, data sharing expectations, and payment, though we're going to do more on payment today. And I do want to kind of tie this into billing and claims, which we'll go through today, as well as some of the application pieces to become a community supports provider. So we'll jump into all of that. So just a quick overview of the billing and claims. Community supports providers are expected to submit claims to partnership using national standards to the greatest extent possible. We do know that some organizations are better able to do that, and some still need some support to get to those national standards. And so the state has said that the managed care plans need to allow community supports providers to submit invoices as an Excel-based workbook or a web-based form or portal. And for providers who can't use the standard terms, they can submit invoices, but they must include what's called the minimum necessary data elements as defined by DHCS. And I will say, Partnership has done a great job creating an invoice template for all of the community supports providers to use that include all of the state's minimum necessary data elements. I always get tripped up on that phrase there. So we're going to go through what those data elements are. They are on the template that Partnership has provided, which is linked here. And then the other thing the state says about billing and claims is that they must allow community supports providers to submit invoices through either a web-based portal, an SFTP upload, or a secure email. And Partnership, I don't know, what do you guys require for the invoice template if they're using that Excel document that you've created? How must they submit that to you?
They submit it via the portal, or they submit it via fax.
Okay, perfect. Thank you for sharing that. So let's jump into these minimum data elements the state requires. And I will say again, they're on the Partnership template. They're in a slightly different order than what the state has them in, but you'll find them all there. And this is just for you to understand as you go about doing these services, what information you have to collect and keep for each invoice or claim that you submit. So you have to have all of the provider information. You have to have the member client ID. If you have it, the medical record number for the client you're serving, the client's name, and the client's homelessness indicator. And if you have questions about how to find that homelessness indicator, I know Partnership has some great guidance or can offer support in that. You need to have the member's address, date of birth, and then you need to have the payer's identifier and name, which is pretty standard for Partnership and for all claims. One thing that gets a little bit tricky is the procedure codes. And I think that there's some great guidance on the Partnership website about what codes you use for which community support service. So that should be easy. If you have questions, I know that Debbie and Paula can help you with those. The modifiers. And then one thing that's been really important is the service start date and end date. And I know that we had some discussions around this last week about if you need to extend an individual service date, how you would go about asking for that through Partnership. So it is possible to extend their service date. Service name is an optional field that you can fill out. How many times you see the person, so it depends what the service unit is. It could be a per diem, so how many days you've served that person. It could be a PM. It just depends on what the community supports payment model is, which you would enter here. The place of service, the member diagnosis code, and again, that should be provided to you by Partnership. If you have questions on that, please reach out to folks. The service unit cost, the service charge amounts, and the final invoice amount. A few more things that are really important here. You have to have the invoice date and invoice number. Controller authorization number are both optional. Now on Partnership's form, they've actually added 3 additional fields, which I think are really, really helpful for providers as they go about submitting claims, especially if you're new to Medi-Cal claiming. The first one is the TAR number, the treatment authorization request number, or the authorization number. And I find this, do it in Excel so you can actually track what the authorization number is from Partnership for each individual you're serving for your community support. That's going to be really important to having a successful claim that gets paid in a timely fashion. The other 2 fields they have, which Partnership will fill out, is a response status and a response description. So has your claim been accepted or has it been rejected? And then it would be, why was it rejected? And I think especially if we're learning how to do these claims for community supports, having those reasons can be very, very helpful to try to build successful claiming. Partnership, anything you want to add to this slide here, or how you guys work with folks who may have some claims that are not accepted?
We have a team that actually reviews all claims coming in for community supports, because if the modifier is incorrect or the quantity is incorrect, then it is not accepted. Or if the ICD-10 code is not a social determinants of health code. And so we make sure that when we approve the TARs, we put the approved ICD-10 code on there that we recommend you put on the claim. It may not pertain to the diagnosis for that member, but it pertains to community supports, and that's how you get paid out of the community support bucket, because remember, community supports is not a benefit, it's a service. And we
That's
also
really
have
helpful.
we also have a help desk that you can call or send an email to, and we reach out.
Wonderful. I think it's really great to have a lot of the information you need on the TARs so that folks can refer back to them to help fill out their claims. So I do encourage folks to figure out how to track this within your organization. I think this can be challenging for some organizations. How do you track all the information coming in to be able to put it back onto the claim to get paid?
We do send what's called a status print. So when the TAR is approved, it comes with all of the pertinent information, the member, their SIN, what you asked for, what was approved or what was not approved, why it was not approved, or if it was modified. And that you should attach to whatever you submitted so that then you can go click, click. When it's time to do the claim, it's all right there with you. I know on my side, it sounds simple and maybe it's not that simple, but that is what most of our providers have worked out doing.
I think it can be a challenge the first few times to figure out how to collect everything and store it. Yeah, absolutely. Any questions on this minimum data elements and the invoice template that partnership has put forth?
If you can figure out how to do electronic billing, we have a portal that is actually pretty simple. And then you get paid. The turnaround time is faster and the amount of data that you have to keep track of is faster or less. So we do try to work with people to be able to upload stuff into the portal.
Great, thank you. And do you have trainings on the portal on your website?
Absolutely.
Or do you just do that?
We do group trainings, and then we do one-on-one with the people that are actually submitting the claims and or the TARs. Yeah, we do a lot. And then we have roundtables every month so that if you have questions or concerns, we can bring it up for all the providers that are attending, so that in case many other people have the same types of questions, we can answer it in a full group.
Wonderful. Wonderful. Thank you. All right. Let's jump into our next segment here, preparing for contracting. I do want to do a quick overview of the contracting process for community support, talk a little bit about the NPI, the National Provider Identifier, which every community support provider must have. And then we'll do a case study to think about how do we decide if contracting is going to work for us. And it gets into the question we had earlier in our poll about how do we know if the ECM rate is going to cover our costs. We can talk more about that. So first, an overview of the contracting process. If you are new to this or still thinking about becoming a community supports provider, getting the NPI is the first step you should do. It takes about 15 minutes online. We do have the state guidance memo here in the slide deck. So when you get it later today, you can click on it and start that process. It's pretty simple, but you have to have a National Provider Identifier, numeric provider identifier. There we go, for all community supports providers. And then I think the next step is to really reach out to partnership and start the conversation with partnership. What is their process for contracting? What are they looking for? What is their timeline? All that good stuff. What we see across state for all Medi-Cal managed care plans is the certification process for becoming a provider. And that's really a chance for you as an organization to validate your experience in a community support service, you know, how long you've served individuals, what populations you're serving. So it's really a chance for you to show off your expertise and experience. It's also a chance for you to show that you understand what the standard terms and conditions are and that you're going to be able to meet them. One thing that we've encouraged folks to do across the state as you become a community supports provider is really to update your policies and procedures to reflect the community supports language and services so that it really does mirror what the expectations are, both from partnership's perspective as well as from the state. I think that's a really important piece to do as you begin your community supports experience. The third step is gap filling, and this is done, I think, continuously as we look at what it takes to become a community supports provider. We know that organizations have gaps to do this successfully, especially if you are an organization that is not contracted with a Medi-Cal managed care plan before. So really being aware of what your gaps are. Maybe you need some staff training, maybe you need that support that partnership offers about doing the claim submission through their portal. But just really identifying what those gaps are and then working with partnership to try to address those gaps. And we'll talk about some funding opportunities later on today that might help you fund filling those gaps. So that's an important piece. And then step 4, I think, is to negotiate and justify rates. So working with partnership, you'll see what their contract options are. And I think there's always, we encourage all organizations to negotiate if that does not meet your needs. Work with partnership to figure out how to get your needs met to become a community supports provider.
So I do have to add that partnership, first of all, we have an assessment that it's called a readiness assessment. So if you're interested, we send that to you first with a FAQ sheet that gives you basics about community supports and which supports we're offering. You fill that in and it asks how many people you want thinking about serving, which services are you thinking about doing, what counties, stuff like that. And then as far as pricing, we are mid-rate DHCS pricing. So we don't negotiate differently for all the different providers. We stay standard across the board for all of our counties and all of our providers.
That's good to know. Thank you for sharing that, Debbie. And then your assessment, is that helping folks identify what their gaps and needs may be as well? Is that part of that process?
Yeah, because it says how many are you currently serving? What are you currently doing in your county? And what are you planning on adding? And what will it take to add on that? We also do a capacity report monthly that goes out to every provider once they are contracted to see, are they at maximum capacity? Can they take more? Once a provider says, you know what, hold off, I don't have capacity to see anybody right now, we stop doing referrals to them until they let us know. And if we don't hear from them in a couple of months, we call back out and say, hey, what's going on? Are you doing better? So we're in communication with them on a regular basis, because it's not going to do us any good to refer to a provider that doesn't have the ability to see more members.
Great, that's great. Any questions on step 1 here? We'll go into the National Provider Identifier, 15 minutes online. Make sure you fill that out. It's pretty self-explanatory, and there is some good guidance from the state about how to do that. All community support providers need that NPI. It's really important to do that. If you already have one, you do not need to reapply to become a community support provider. You can use your existing NPI. Yeah, and there's DHCS guidance on the DHCS website, and then partnership also has it linked on their website, so you can access it through both channels. All right, let's go through payment approaches. So in talking with partnership, they use 2 primary modes of payment. One is the PMPM, and the other is a fee for service. So I wanted to just talk through these a little bit more detail and look at some of the pros and cons for organizations as you're thinking about becoming a community supports provider. What does this mean to you and your work? And how do you think about budgeting for this? Because sometimes these payment models can be a big shift from what you're used to in terms of budgeting. And partnership staff, please feel free to jump in and weigh in here on the different models. So the first one is a PMPM, there we go, per person per month or per member per month bundled payment. It's a single payment you get for serving an individual for 30 days. So if you start serving someone November 15th, you're eligible for payment on December 15th for that 30-day period. It doesn't matter how many services you provide that individual during those 30 days, you're paid a flat rate. So in thinking through that, some of the pros is you have a predictable payment each month, so you can know what you're going to get paid and help fund staff and other costs through that predictable payment. It is only for 30 days though, so if somebody exits community supports after 30 days, you lose that PMPM payment. I think the cons, and I want everyone to jump in here and share some more, but the cons for me are the costs vary. based on the member's acuity. So if you have someone who's high acuity and he needs more touches per that 30-day period, you're going to spend more to serve that individual. And that's, you don't always know that going into it. And I think this can make it hard to develop a budget beyond the 30 days, right? You don't know if you're going to keep a member for 30 days, 60, 90, whatever it may be. Anybody want to add to the pros and cons for PMPM?
I appreciate that you pointed out per member per month is every 30 days. So you can't bill for December 10th and then bill for January 1st. It has to be a 30-day window between the two or it won't be accepted. For community sports, again, because it's not a benefit, it's a service. If you're doing housing transitions, let's say for a family, it's one member that will have a TAR. So it's per family, that will be that one service because you're trying to find one house for that family. And yes, if the member drops off, then you can't bill for them, of course, any longer. The acuity for community supports, there has been some concern about acuity. However, I think we've had one complaint about the acuity, and that was because of the mental health needs of the member. And then they were also in ECM, so they're getting that support of the social worker and the ECM worker case management as well. So yeah, it hasn't been, thus far, hasn't been too big of an issue.
That's great. And I know for a lot of folks, for budgeting, I know that partnership does 3-month TARs. Is that across the board, Debbie, or does it vary by individual and community support?
We currently do a 3 month, but we are investigating starting in January of extending that or making it a longer amount because it's a huge administrative burden, not only for the providers, but for partnership. And because housing is such a challenge in California or across the nation, pretty much, 3 months is not really long enough to get somebody housed. But because of all of the huge requirements of reporting for DHCS, that's why we needed to do that to be able to stay on top of that. But we are looking at extending it.
That's great. So in terms of budgeting, you may have 3 months of relative security unless somebody drops off, but that you could depend on and budget for staff and things too if you have that 3-month TAR.
Yeah, and we have not, if they're in it for 3 months and not housed, we then extend another 3 months and so on and so on. So it just has to be validated that the member's engaged in the hunt, if you will, and that there's been at least one touch per month.
Okay,
Again,
so
this is brand new to all of us, so we're learning as we go.
No, I think that's true across the board, and I appreciate your willingness to think about what's working, what's not, and work with providers. That's great. Any questions on the PMPM payment model or how it might impact budgeting for your organization as you look at becoming a community supports provider? All right, well, we'll jump into the next payment model, which is fee for service. And this is usually for a unit of time, or it could be per meal. I believe, Debbie, you said you do mostly per diem fee for service.
Per diem fee for service, we do not do units of time. We do number of services. So for instance, housing, tenancy, and transition, you can do up to 2 per month. And so there's one payment for each of those visits, 2 or more per month, the maximum is 2. For medically tailored meals, we pay per meal or per bag of groceries.
Great. And so I think this can be a really helpful payment model for that because you're getting paid for what you do within the limitations as Debbie just outlined. So you're paid for each increment, so daily or meal, that's helpful. But again, you know, some individuals may require more services. And so figuring out how to make sure that you're serving them appropriately within the payment model outlined, I think can be a challenge for this type of payment model. Can also be a challenge to track that. And I don't know, Debbie, what kind of guidance you give to providers to help them track these fee-for-service payments, or services rather.
We give, if it's 2
Whatever's
per
needed.
month and we are giving you 3 months, we give you a count of 6. When you've reached that count of 6 in that 3-month period, or each month, each 30 days, you can only bill for 2. And so you'd be surprised how well people keep track of those things.
Good. All right, and then the last payment model that's commonly used is cost-based reimbursement. We often see this with housing deposits, and so you have to get approval, as Paula outlined last week, about the amount for a housing deposit, and then you can go ahead and secure that housing unit for your member, and then you can invoice partnership for it. I think the pros of this is you have clear guidance as to what you can spend, so you don't blow your budget. One of the cons that we're seeing around the state is that organizations need to have that money up front to spend and then get reimbursed for it. So getting that cycle going can be a challenge for housing deposits. Have I missed any pros and cons? Anybody have anything else they want to add, or things they're thinking about, or have questions about these payment models and how they work?
The other, I don't know, I guess it would be a con, is that not everything is a deposit is going to be approved. They have to be deposits. It can't be for amenities for the home, such as beds or tables or couches. It has to be deposits for security deposits and or deposits for your PG&E and the water bill. If you forgot to pay your water bill when you left your last place, and they won't turn on your water unless you pay that, that could be part of that. But it's people are frustrated that we don't just give them $5,000 to spend. But this is taxpayer dollars. And at this time, Medi-Cal does not cover rent. And so that's why it's for deposit. So we have our people submit a itemized list of what deposits they need. Then they do have to pay them and submit to us the receipts for those payments, and they get reimbursed. We do treat housing deposits as an urgent request because we don't want somebody not getting housed because we didn't approve that we will reimburse for that housing deposit.
So what's the average turnaround time then? If I submitted a request for a housing deposit, what does the urgent request look like in terms of days?
So if you get it to us before 3 o'clock today, it will be done today. If I get it at 4:55 today, it's going to go tomorrow. It's as soon as I see it, but we do watch our queue really carefully. We have some people that when they put in for a housing deposit, they give us a call so that we immediately know, and then we'll pull it and review it.
Great. And then when I submit the request for the deposit, would it be helpful if I listed all of the different items that I am going to be spending the money on, so you can clearly see?
That's exactly what you have to do. Yeah, that's exactly what you have to do.
Okay, good. So there's no surprises afterwards.
Yeah, and so that you don't spend money on something that's not going to be covered. They also have to be in housing transition navigation to be able to get housing deposits. That's a state requirement.
Great. Any questions in the chat, Carrie?
No, we're okay right now.
Okay, wonderful. All right, anything else to add to the payment models? First, I love it. Let's jump into our case study and talk through what you might be thinking about as you become a community supports provider, or even decide if you want to do it. So we are going to start with our Housing First is a local housing provider that's interested in contracting for the housing transition and navigation, housing tenancy and sustaining services, and housing deposit community support services. Housing First has never contracted with a Medi-Cal managed care plan before and has received most of its funding from HUD, the county, and the city. So this is a whole new experience for Housing First. They've read the community supports information, the policy guide, they've done some webinars, and they think this might actually fit into their mission and the work that they're currently doing. What are some of the key questions Housing First should consider before initiating contracting with their local managed care plan? Anybody have any ideas of what's a good question to think about, to work through as an organization?
Do they have the lay of the land so that they can actually work with members in finding housing in the counties that they'll be serving?
That's a great one. Do they have a lay of the land? Absolutely. So I'm a numbers person, a budget person. So my first question I'm always going to ask is, what is the payment model being offered by partnership for these housing services? And how does this impact my budget? How does this payment model impact my staffing? So that's one of the first questions I'd be looking at and trying to figure out what is the payment model. I think Debbie mentioned they have different payment models for each of the housing services. So taking that into consideration, how you allocate staff, how you document services being provided for these different payment models and for the claims. So thinking through that. The next question I might ask is around my staffing model. What do I need for each community support service? And the state's policy guide has a lot of great information about what the state's requirements are, and I believe partnership follows that very closely. And so what is that? What is the requirement? Do I need to have a lead case manager, for example? Do I need to have a licensed staff for whatever community support you're doing? What is the requirement for staffing? And then how do I build my team to reflect payment models, to reflect service requirements and expectations? What does that look like? And then I think Debbie alluded to this earlier, but how many individuals will I serve at any given time? And so it sounds like partnership asks for an organization's capacity, how many folks they can serve at any one time, and that can be capped at a certain point when you're full, and you can also ramp up as you're ready. So I think that's really important, but this also ties back to your budget. How do you start to staff up to really meet the service needs, meet the members' needs, but also make it doable for your organization? What does that look like? Any questions on these? All right, let's keep going then. So I would also think about, how do we submit and track TARS? What does that look like for my organization? Do I have technology to do this? Do I have a good Excel person to help me with this? How do folks enter and document their services? I think this can be really challenging for a lot of organizations who've been working off of paper for the past several years to try to think about this additional documentation and making sure you get it done correctly so you get paid. And that we have seen some delays across the state with folks having, needing time to figure this out, and then payment can be a little bit delayed. So I think thinking through this before you jump in and start doing the services is really important. Set up those systems. We do have some organizations that have hired billing specialists, either on a contract basis or full-time, to help with all of this work here and to really make sure this runs smoothly. So that's an option to think about as you look at all of this. And then what invoicing and claims systems can my organization use? We know partnership has a portal that you can use, but you may also need a case management or a care management system for your organization to help you do all the tracking that's required. So thinking through, what does that look like? Who needs to be trained on this new system? How do I purchase it? Where does the money come from? So all of these questions I think are really important to think through this. And the other piece, which I think partnerships portal can help with, but we're seeing struggles around the state with this, is reconciling payments. So you may get a check, and figuring out what you were paid for can be challenging, and what you were not paid for and why you weren't paid for certain claims. So processing all of that can take time and staffing to do correctly. And then what organizational documents need to be updated to become a community supports provider? Do you need to have an updated org chart to reflect this new line of work? Again, I really suggest policies and procedures should be updated to use the state's language for community supports, whichever services you're providing. Workflows may need to be different as well, especially as you look at the new claims and invoicing process and what documentation is required. who's going to do all of this? So really thinking this through before you jump in. I think once you do jump in and have all these figured out, it will make your process go smoother and hopefully help you get paid efficiently. What am I missing here? Anything else? W said lay of land. Anybody else have ideas of what we should be thinking about, what questions we should be asking before we decide to become a community supports provider? If you're already a provider, what do you wish you would have thought about before you jumped into providing services?
I mean, I think for me, speaks to my question about, is the ECM rate going to be able to cover costs? I mean, I think that's still my primary question is like, I don't know. A lot of this it's clear in terms of the process, but for those of us that are not already providers that are looking to build our capacity, I'm just wondering if it's cost effective.
And Amber, do you think, is that a question for like the startup costs for doing this, or is this the ongoing cost of doing that? Does the ECM rate cover that? Because I think sometimes those are two different set of costs, and there are different funding streams for the startup costs that we'll talk about later today. But are you thinking of it as an ongoing issue?
I'm understanding it as an ongoing issue. That's the feedback that we're receiving from Napa County, is that on an ongoing basis, that ECM rate is not gonna. What did she tell me? She said the juice wasn't worth the squeeze or something like that. And I was like, okay.
Yes.
I think, it's, but just to be completely honest, like I don't want to, derail the meeting and all, but I'm like 3 steps back from this webinar. This is super helpful. I really appreciate it. But we don't have a plan in Napa, like not on the move, like the community. So I'm not even clear. And aren't clear in this community, like is anybody even gonna do this? And if so, like what model are we using and all that kind of stuff. So it's hard for me to figure out if it's cost effective when I have no idea actually how this is all gonna work. Well, the only thing we do know is that human services in Napa is like, we are not gonna be the central billing hub. So it's like, okay, well, we can check that one thing off the list. Now there's about 1,000 other questions to try to get answered to figure out how this is gonna work.
We could certainly do a one-on-one with you and your company, especially after we would look at an assessment. I'm sorry, Napa doesn't think the juice is worth the squeeze, but they certainly have lots of members that are getting community supports and ECM. And we have other providers in Napa that are also participating. This is not going to be a get-rich scheme. This is DHCS funding and it's taxpayer dollars. But we actually haven't heard that people are not on a regular basis, that they're not making money, because it's how you bill for it. It's making sure that you're billing for all of the services that you are doing, especially in ECM. Community supports is much more cut and dry, because here's the service, here's what you get paid, move along. And until it becomes a benefit, which we don't yet know if it's going to happen, that's the way it's going to be with community supports. Again, we get no reimbursement, so it comes out of all of our resources. But certainly we could meet with you and see what kind of a company what your activities are and what you would be looking at. Because when you look at it one-on-one, I think that it's easier to sort of paint a picture. I know that Napa County is overseeing a lot of things. And so for them not squeezing enough juice, I'm just not sure why that is. So they should certainly reach out to ECM for that as well. And I will put a crinkle in their wrinkle and let them know that they need to reach out, because we don't want to hear that people are not benefiting because of the financial end of it.
Mm-hmm. Yeah. And let me be clear. I haven't formed any of my own opinions. Like, part of why this is so challenging is because, and this was what I put in the first poll, right? Is like, the surprise for me is like, people that I feel like are supposed to know this, like, don't know. And for whatever reason, because they're overwhelmed, because the state hasn't released the info, whatever, right? All these different reasons. And so what I'm getting a lot of in my community is, well, they're supposed to do it. No, they're supposed to do it. Well, we don't know who's supposed to do it, and it's just, and so I think everybody has opinions. And I think that you're right, that everybody has formed opinions based on a slice of the information that they may or may not understand.
Right.
And so
right.
I really need some help putting all the pie pieces together. And don't worry, Debbie, I wrote your name down specifically to reach out because I was like, she knows what she's talking about. So
I've been doing this now for a year. Woo. And if I don't have the answer, we will work it out together. And I think that Napa County is unique. And I say that because they sort of had a monopoly at first, especially for the housing stuff. And as we've worked together, we've smoothed out some feathers and have realized how much we all can help each other, but we continue to learn. And so there are still plenty of room for others to join. As we learn and as we share, we'll see that the pieces of the pie do and can fit together.
Yeah. Thank you.
Holly, you want to jump in here?
Oh, yes, sorry. And also I wanted to add, if you ever have questions, including anything related to community support or even ECM, I have also shared the CalAIM inbox. Those questions do come to us, and we can definitely try to get an answer or give an answer to you as soon as we can. And also I sent the readiness assessment. If you're interested, you can just forward the readiness assessment to the same help desk.
Yeah, no, I appreciate that. I think, again, like, it's hard when you don't know the questions to ask,
Of course.
to send questions to the inbox, right? So that's been my problem. And then trust me, I've been looking at the readiness assessment. I pulled it up last time. I got it this time too. I'm just like, for me, it's not about my organization necessarily. It's kind of like I said, like, how are all the pieces coming together? So I am in this, I am paying attention, and I'm going to understand. So don't worry about me. I will get my needs met.
Good.
I love you raising this, Amber. I think this is a really important question, and I think we need to make sure folks feel like they have a place to get their questions answered and to even know what questions to ask. So we want to keep the conversation going. I know partnership, you have roundtables every month. And then Amber, the other thing that's happening in addition to the partnership roundtables is the state is launching what's called a planning collaborative initiative, and there's going to be a facilitator that will be starting that in January. And so I think that's another great forum to go to talk to other providers and find out what they have experienced. So you're going to have two different groups you can work with. I don't know, Debbie, if they're going to be merging or not. I know some counties are doing that and some are not, but I think you can get some more support through the planning collaborative as well.
Thank you.
All right, so we have some costs. We know we have costs to get started, and it sounds like there's some questions about ongoing costs, whether or not the rates cover that. But I want to focus on some of the ways we can think about covering the startup costs, especially getting our systems in place to actually do this work and to invoice to get paid for it. So I want to jump into our funding opportunities here and talk about a couple of different, actually there's a lot of things going on, but we can talk about a few of the ones that are currently open for applications and how folks can jump in. So the big one that people have heard about is the Managed Care Plans Incentive Payment Program, IPP is what it's called. I know that Partnership has already given out its first round of funding, so that window has closed. The state has recently changed the timeline and some of the metrics, and so I know virtually all managed care plans are kind of on hold if there's going to be more rounds of funding going out or not, but that is an option if Partnership reopens. I'm sure they will advertise their application process and timing and all that good stuff, but this has been a good source of funds for folks earlier this year. We do expect there'll be more dollars coming from the state, but we don't have clear timelines or even goals right now for that. This does really support folks building capacity, putting investments into system infrastructure. And so a lot of the plans have done both provider related investments, and some are doing some community-wide investments. You can see different things going on with facilitation of meetings, of TA, of various things to help really educate communities about ECM and CS. So that's the IPP program. We also have a few other funding opportunities, which I think are a little bit more coming up quicker than IPP's next round. And the biggest one that I want to talk about is path, and they have one called Capacity and Infrastructure Transition, Expansion, and Development. We call it Path Cited. These are also great funding opportunities for the startup costs, and you are eligible to apply for them as an organization who is in talks with managed care plans about becoming a provider. You have to have some certification from an MCP to apply. You don't have to actually be a provider yet, but you have to be working towards that to apply for the cited funds. So if you are part of the county, if you're a local organization, if you're a public hospital or Medi-Cal tribal or Indian health program, you can apply for these cited funds directly. And this is aiming to encourage coordination among stakeholders in the county. So not just you know, an ECM provider network, but both ECM and CS to really come together to address some of the gaps and needs in that community for ECM and CS. The funds are allocated by county, and the funding windows go through 2025. Some of the things that past cited funds around provider workforce, you know, purchasing or training staff on referral billing systems, that's really important. Capacity and infrastructure. So maybe you need a bigger space or a different type of space to provide the community support services or ECM services. Some of the cited funds can help with that. So that's really important. You need new computers, or you need, you know, iPads or whatever it is you're using, tablets to go out and do your work. There's funds for that. It's also working at how do you outreach to populations? We really want to make sure that providers are reaching out to folks who have been historically underserved, and they want to fund that through Path Cited. And of course, there's several other options too that they'll fund, but these are the big ones. Now, we know that the first application window for Path Cited closed September 30th. DHCS received 232 applications in that first funding window for a total of $518 million in requests. Because of this, they are actually taking a little bit longer than expected to go through these applications, but they anticipate awarding the funding in January. And currently the state says they will open up the second application window in January. So again, if you're looking for ways to fund some of these startup costs for ECM and CS, Path Cited is a great opportunity to do that. Any questions on Path Cited? Right. So the next one is also part of PATH, and it's really targeted towards the justice-involved populations. Those are coming online for ECM probably in 2024, but they do want to help with the planning for these populations, and some of the folks who are in the justice system are eligible for ECM community supports through the other populations of focus, but they have 2 rounds of funding. One is closed for planning, but they have a round 2, which is trying to help implement Medi-Cal applications for those folks who are 30 days out from being released. They're really looking for organizations who are working with these populations. So if that is you, there's some funding out there for that as well. Now, these next 2 are coming online in January, and I think they could be really helpful as you're thinking about becoming a community supports provider. One is a TA marketplace, and that's going to launch probably towards the end of January. And that's actually saying, here's what I need. I need help with training my staff on ECM workflows. And they're going to allow you to access TA from a library of providers, a marketplace of providers to get that support. And so that's going to be something new, and it's going to be really exciting to have access to all this TA for exactly what you need. So look out for that. And the second one I mentioned earlier is the Collaborative Planning Initiative, which is going to launch probably in early January. And that is, the state has assigned a facilitator to your county or to your region, and they will be hosting monthly collaborative meetings that's trying to bring together the ECM and CS providers and address implementation challenges. So again, if you're not even sure what questions to ask, this may be a great forum to attend, as well as the roundtables that partnership offers to really understand what the issues are, do some networking, do some learning from your peer organizations. The trick with the collaborative group is you need to register on the state's website initially, and we have that link here. And again, I think we're trying to get all of the facilitators to host a meeting or to do some outreach in the first 2 weeks of January. Any questions on these two? All right, so we'll keep going. We'll jump into our poll here, our third polling question. And this is to help with the evaluation of our project here today. So if you could please review the list of historically marginalized populations or underserved communities and let us know which populations you are working with, that would be really, really helpful.
Right, I'll give that 10 more seconds. All right. So it looks like, sorry, go ahead. So it looks like 100%, everybody is Medi-Cal eligible children and adults. And then we have individuals experiencing houselessness, other underserved populations, and also BIPOC plus communities. Great, thank you.
We'll go into one more poll. Again, this is going to help us design a third session that will really be meeting your needs here today. So of these takeaways, what was the most helpful to you today? Understanding the context of CalAIM and the relevant background of community supports, reviewing standard terms and conditions. We did a little bit today, not as much as last time, but talked about those minimum data elements and some of the state's requirements around claims and invoicing. How to get in touch with your managed care plans. We have them here today, and they've been really great at jumping in and answering questions. We greatly appreciate that. And then some of the basics, we covered a little bit of the national provider identifier process.
All right, give that 10 more seconds and I'll go ahead and end this poll too. All right. And it looks like the consensus is understanding of the context of CalAIM and relevant background information about community supports. And second, we reviewed the standard terms and conditions for provider contracting. Perfect.
Wonderful. Thank you, Carrie. All right, so we are just about finished with our presentation today, but I do want to make sure that we point out there's a post survey for this session, and this does help us plan for the next and last session. Your feedback last week was really, really helpful to customize the content for where you guys are and what you're interested in. But I also want to make sure that we save some time here for any final questions or comments or thoughts about community supports.
Is partnership contracting with community supports for mental health services?
Part of members that have mental illness or medical illness can get community support services, yes.
Okay, thank you.
Yes.
My question is not necessarily about the community support services, but it is because this is helpful. So maybe you guys can help us. I really am interested at some point in understanding like what is going on at the schools or at the county office of education. Like I have no idea what they're doing and how it relates to any of this. And it would be super helpful if you guys had like a PowerPoint on that at some point.
We actually are working on putting something like that together for continuity of care as well as continuum of care. We are working with the schools. And since we will be bringing on youth and adolescents into our service plan, we are working with the schools and the districts. So indeed, pretty soon there will be a PowerPoint, and I'll make sure that you're involved.
Thank you, Debbie. You're going to be my new bestie. I can tell already.
I love it. Building partnerships, relationships. I love it. I love it. All right. Anything else folks want to ask while we have Debbie and Paula here on the hot seat?
Paula has her hand up.
I think that's an old one.
Oh, I'm sorry, ladies. I never took it down.
That's okay.
All right. Last call. All right. Well, thank you all very much. Oh, go ahead, Debbie.
Sorry, just on behalf of Partnership and Transform Health and everybody else that has participated in all of this, we appreciate your time. We know that time is valuable, but if we don't answer questions or have the outreach, then everybody's sort of the blind leading the blind. So really appreciate y'all taking your time to come and share with us your concerns and listen to what we have to share.
Well said. Thank you, Debbie. Thank you all very much. I do look forward to seeing you next week. And if you have questions or concerns or ideas of topics besides the school-based work, which Amber, I'm glad you raised, and it sounds like Debbie's going to be getting something together for you guys, please let us know. All right. Well, thank you all and have a great rest of your day.
Thanks. Bye-bye.
Thank you.